Okay, this is my urinary catheterization station. It's called an in and out cath. Okay, so I've been given my S-bar and my MAR and so on and so forth, and it says this poor patient has a residual of 250 in her bladder, and the doctor wants her cath if she hasn't peed in more than 6 hours, or if she has a residual over 200. So we will be doing the urinary cath. First thing I will do is gel my hands. I'm going to take my paper, select my mannequin, blah, 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 set her up here, and then I'm going to identify my patient. This is Vagina 81176 1 2 3 4 5. Vagina 81176 1 2 3 4 5. Okay, paper over here, gel my hands again. Now I need to collect my kits. I have 2 kits available to me. I'm going to get some sterile gloves, and I'm going to select a urinary vinyl catheter tray with a 14 French. Okay, so we're going to go ahead and open that stuff up. Okay, proper receptacle is over here. Okay, now we're going to do what I call the sterility dance. I have to exaggerate a little bit because I'm a little top heavy and I don't want to be seen as bending over my field. Okay, so I'm going to open the tray away from me. Okay, so we're going to go pop away. I'm going to go over here and pop away. Go over here, pop away. And at this point, I don't want anything touching the chuck for the mannequin. Okay, and then we take this little last tab and we pull it away. You can kind of straighten things out on the edges. Okay, it doesn't hurt. Gel your hands again. When in doubt, gel out. Okay, and we are going to I'm going to go ahead and expose my mannequin. Okay, stepping away. Then I'm going to take my sterile drape just by the corner, stepping away, shake it out, and then I'm going to check shiny side down. Okay, I'm going to bring it over to my mannequin, stand behind her. Okay, now I can always pick up the mannequin, and readjust that. Okay, so now we have a sterile field still. Okay, once again, re-gel my hands. Again, doesn't hurt. If you're at a stop point or a thinking point, to go ahead and gel your hands. Now I can now go underneath that drape that the boat came in and move it aside ever so gently, okay, without touching the boat. I'm going to open up my sterile gloves. My hands dry just a little bit. Okay. Let's see. So you can see me here. Now, I have 2 fingers in 1 glove, but that's okay, because I can fix that once I get the other glove on. And, now I'm really screwed. So now I could always grab my other kit, or another set of sterile gloves. I'm going to try and make this work without violating the sterile field. Okay, now here was where my problem was. Yes, careful of rings. Okay, so let's pretend that these are sterile. Okay, so now I'm going to take and reach to the sides of my boat. I'm going to reach in I'm going to open up my swabs, and from the bottom, push those up. Okay. And then I'm going to take my gel, squirt it in there, done. Okay, now I can take my boat, in theory, move it closer to my patient, okay, with my non-dominant hand I'm going to go far, near, down the center, and I'm going to put the tube in the lube and make sure the spout is close, and I'm going to 2 to 3 inches for a female, 4 to 7 for a male, no resistance noted, no return. Okay, we'll set that aside, move it back. Then I can take the wipe her down, and go ahead and deglove. And that's the last chance for these gloves because they got caught in my ring. Okay. All right. And then I would document. So any critiques, any questions, let me know. Thank you.